Hello. Today I'll be discussing Jake Schmider, my patient, and going through my theoretical plan for his first session. The session goal will be to introduce mindfulness-based cognitive therapy, introduce mindfulness, and set up a self-led mindfulness program. The long-term goal of Jake's therapy in general will be to reduce his day-to-day anxiety. So, what is MBCT, mindfulness based cognitive therapy? Well, it aims to develop the patient's attentional control and resistance to negative thoughts through mindfulness. And mindfulness is the conscious bringing of one's attention into the present moment. Specific practices that do this are directed journaling, breathing, thought identification and challenging, and meditation. So, Jake struggles primarily with anxiety. That's pretty obvious through his initial interview. And anxiety, as I'm sure you're well aware, is the perceived threat, the perceived, yeah, a perceived threat in the future. And it's a protective mechanism. So bringing one's attention into the present moment, by definition, eliminates anxiety, at least for that moment. So the skill of doing it, in theory, allows one to escape from anxiety when they would like. Um, so just based on the ABC model, just framing Jake's anxiety, he is primarily concerned with his perceived excellence. The example he gave was his boss, leading to behavioral paralysis, and then leading to a general decrease in action, which made him more anxious about his perceived excellence because he wasn't doing as much. Um, the spiral. So, in theory, MBCT would allow him to identify useless anxiety, so anxiety about things that are uncontrollable, like his boss's judgment, um, and attenuate that. So he would know that anxiety about uncontrollable factors is useless because anxiety is meant to protect us, and you can't protect against the uncontrollable. So he would be able to look at that anxiety and be like, okay, this is not useful for me to attend to, and look at other anxiety like, I want to get my work done so I can maintain my quality of life, and attend to that. So it wouldn't eliminate his anxiety completely, which is a good thing. Um, yeah, so anxiety being helped through the skill of mindfulness is well supported. A meta-analysis of 19 studies displayed that mindfulness and acceptance-based intervention significantly decreased anxiety with a comparable effect size to a meta-analysis studying cognitive behavioral therapy. Another study displayed that over 5 weeks, MBCT lowered anxiety, stress, rumination, and perfectionism within perfectionists. Um, a recent study in 2024 displayed that mindfulness-based interventions decreased stress overload in 195 nurses over a 4-week period. So the question I'm sure you're asking, and what I've kind of asked myself throughout this process, is why not CBT? The main reason is the use of telehealth. Uh, MBCT is more self-led than CBT, and also has been found to be more effective than self-led CBT for the treatment of anxiety. Further, it's more difficult to cultivate a therapeutic alliance over telehealth, making the actual face-to-face therapy less effective, which I've kind of taken as the self-led part of therapy being more important. So that, yeah, that's why I've kind of chosen it. Um, this creates some issues. The relying more on self-led um, practice relies on Jake completing that self-led practice, and also mindfulness. It's a skill that needs to be practiced consistently for it to be effective. So needing to complete it and needing to complete it consistently might create more anxiety within Jake, fearing my judgment like he fears his bosses. It's super important, therefore, that I emphasize that homework is optional whilst educating Jake thoroughly on um, why mindfulness needs to be completed consistently, hopefully producing an intrinsic drive to complete the practice rather than a extrinsic drive based on fear of my judgment. It's also important that I'm super non-judgmental if slash when he doesn't complete the homework. Another issue that may come up is Jake seems to be a perfectionist, not confirmed, but perfectionists have achievement-based self-worth, which means if their perfectionistic behaviors produce achievement, which they usually do, um, then they are reluctant to give up those perfectionistic behaviors, even if they're detrimental to their quality of life. So Jake may be reluctant to give up his anxiety out of a fear of losing his work success, for example. Further, just to maybe remedy that, uh, we will focus on building Jake's self-worth in the long term of his treatment. Another thing to consider is my own bias. I received mindfulness-based cognitive therapy when I was younger for my anxiety, and it was very successful for me. Um, it's important that I recognize the difference in circumstance between myself and Jake and allow myself to be objective enough to pivot if he is not finding it to be useful. So yeah, with the modality, a little bit of theory, and some risks in mind, I will now present the general plan for the first session. Obviously, this is a general plan, no substitute for listening and being flexible. It's also based off the original MBCT plan outlined by Seagull and colleagues in 2002. So the first 5 minutes will be light, reciprocal conversation. How was your day? That sort of thing. Also, obviously, I will explain the limits of my confidentiality to Jake and gain verbal consent to continue. Minute 5 to 15, we will discuss mindfulness and anxiety, how they relate, in a similar fashion to how I've just explained it in more layperson terms. Minute 15 to 25, I will introduce Smiling Mind, which is a mindfulness and meditation app, and we'll complete a 5-minute meditation together using the app. Minute 25 to 35, we'll discuss the meditation that we just did. We'll discuss attention and mind wandering. We'll discuss the compulsiveness of thought and anxiety, and also link that to acceptance and control. So minute 35 and 45, I'll emphasize that anxiety is uncontrollable and that our attention that we direct to anxiety is the controllable part. So anxiety is the reaction to stimulus, and attention is our cognitive part that we can somewhat control. If relevant, we'll link this to the cognitive assessment battery that was done after his initial interview, and then we'll discuss the potential for a self-led mindfulness program through the Smiling Mind app. Then the last 5 minutes will set the precedent that mindfulness is a skill that needs to be practiced consistently, but at the same time emphasizing Jake's choice in completing any homework that I set, making sure not to produce any further anxiety. So yeah, if you have any comments about, obviously I'll wrap up and say goodbye after that. If you have any comments or queries about my plan, please let me know. Thank you for listening.